We have our next presenter, Mr. Anders Eikenes, and he is going to talk about a very innovative solution again, which is going to help the patients with diabetes and may help us in detecting diabetic retinopathy earlier. So welcome, Dr. Anders, and please go ahead with your presentation.
Thanks a lot. First, huge thanks to Dr. Sadhu who invited us here, and also for the organizing committee for bringing us all together. I'm Anders Eikenes. I'm CEO and co-founder in OIVI. We are an Indo-Norwegian startup focusing on early detection of diabetic retinopathy. I have been working in the camera industry for more than 20 years. Last 9 years, I started 3 companies. One failed, one IPO'd and is now listed on the Oslo Stock Exchange, and OIVI is my 3rd startup. We're now 30 employees in OIVI, based in both Norway and in Bangalore. Many of us have worked together in the past, developing and bringing cameras to markets in different industries. But now we have come together again, applying our experience on cameras and artificial intelligence to make a change in early detection of diabetic retinopathy. Of course, you all know this problem we are addressing. In short, diabetes can cause blindness, but early screening can enable early treatment and save sight on a massive scale. Challenge is there are simply not enough eye specialists in the world to do this screening. And the cameras available today are built for these eye specialists. Either they're too expensive, too difficult to use, or produce poor image quality. And only the eye specialists can afford these high quality, expensive automated cameras. And there are already quite a few initiatives applying AI diagnostics for detecting diabetic retinopathy and other retinal conditions, but there are lots of challenges related to clinical use. The process of submitting the images to the cloud for AI analysis is very manual, and there's a need for trained personnel, which leads to extra costs and extra time. So the current system does simply not scale. We need ease of use, speed, image quality at acceptable price points. And that's how OIVI is different. Our cameras are made for use in primary care, such as a GP's office or diabetes clinic. We do not make cameras for ophthalmologists. We deploy it close to where people live and make it both fast and super easy to use, so a nurse or medical secretary can use it. To be able to do that, we automate both the image capture and also deploy the AI diagnostics embedded in the camera, running on a dedicated neural compute chip. Our differentiation is very much linked to deploying AI on different levels. First, we have built a database of pupillary images and built a neural net to track the eye. And normally, the eye specialist does this alignment manually. We have built an AI-based robotic system to automate this alignment. Next, we automatically annotate the retinal images using our embedded AI platform to find features in the image associated with this particular disease. Initially, we provide these images to our remote eye specialists to speed up the diagnostics process. And third, we're building a neural net to do this diagnostics automatically. So there will not be a need for having an eye specialist in the loop anymore. It's a longer regulatory procedure, especially in Europe and the United States. So we are doing this step by step. We don't just want to build a device or a software. We want to build an ecosystem where doctors, specialists, and the patients are connected via seamless service. We not only screen and diagnose patients, but also work with leading eye hospitals and retina specialists to connect patients to affordable treatment. Costs will be reduced, but also the delivery of care will be improved. The primary care provider can add an extra service layer to their patients, allowing for retinal screening and diagnostics, and also tracking disease progression without the patient needing unnecessary referrals to eye specialists. AI may also improve patients' access to eye care, since remote and teleophthalmic screening initiatives can be combined with AI-enabled technologies to help diagnose and treat eye disease, thereby preventing vision loss. AI technologies, once developed, require fewer resources to operate than laborious, time-intensive, and expensive human-led screening programs. Strong partnerships between diabetes clinics and AI-enabled camera and diagnostics companies like OIVI can really make a difference if we combine it with a network of retinal treatment providers. If we're able to do this in the right way, we can potentially prevent blindness among diabetics on a massive scale. AI is now opening the doors at every step of health management, screening large populations, epidemiology, diagnostics, monitoring and follow-ups, and treatment planning. We are now ramping up production, and we're actively looking for pilot clinical partners here in India. So please reach out to us for a discussion. And thanks a lot for listening in. Any questions?
So, Mr. Anders, is there any clinical study which you have already done on this product?
We have done, let's call it a pilot clinical study. It's really about ability to test on patients, of course, in a safe and sound way at an eye hospital, and to get this to feedback into our R&D, and we're planning a larger proper clinical trial this year.
So wish you all the best, and I hope when you present next year at our Congress in a face-to-face meeting, we will be having a lot of data from you.
Oh yeah, we'll bring the camera for sure, and
yes.
Although you get to try it.
Right.
Yes.
Thank you. Thank you, Tushar, for keeping everything in time. I guess despite so many presentations, everybody could present in time, and we are just late by 4 minutes. So a big round of applause for you, because you really made it in time. And I would just like to make one more announcement that we have a startup award also, which will be announced during the valedictory function today from 4:30 p.m. onwards. And this will be in Hall A. So all of you can see it on DocTube and join us in the Hall A during the valedictory session. Thank you, Tushar, for a very exciting session for the first time in any of the scientific meetings.
For me, really appreciate giving this opportunity to me. Have a great day. Really learned a lot from all of you.